Ontario. We would like to welcome you to the 10th of our series of Lunch and Learn webinars for healthcare professionals as part of our efforts to build various communities of practice in the region. I just have a few housekeeping pieces to mention before we begin. So as you will notice, you are all currently muted. In just a moment, I will unmute everyone. So if someone is on the phone but for some reason cannot access the webinar component, please speak up at that time and I'll take down your information in order to troubleshoot offline. Then before beginning again, I will mute everyone once more. If you have any issues during the webinar, please get my attention by virtually raising your hand. And you can do that by clicking on the little hand icon that should be part of that window or dashboard that's on your screen. And then you would type your issue in the comment box or the chat box, which is also in that area. Okay, so I am now unmuting everyone. So if anyone needs to speak up with an issue right now, All right, so I am going to mute everyone once more then. If you have any problems come up later and you're not able to connect to the webinar component, so say you're on the phone right now but you're not showing up online, you can email me at the selfmanagement@kchd.ca email. That was in all of the reminders that got sent to you, and then we can troubleshoot offline via email. So just to let everybody know, we will be answering questions as we go along throughout the presentation, as well as again at the end. If you have a question, please type it into that chat box that I was talking about earlier, and you would see that again on that little window or dashboard that should be on your screen. So I'll keep track of those questions, and during a natural pause during our presenter speaking, I will bring up the questions. I will then unmute the person who's asked it so that further discussion can happen between the presenter and the person asking the question. If a larger discussion needs to take place with everybody, then I can unmute everyone as well. If you would like a printout of the slides with spaces beside it for notes, this can be downloaded from our website, and the direct link to do so was provided in those reminder emails as well. Now I would like to present our speaker for our 10th webinar, Motivational Interviewing Techniques, with Michelle Sorensen. Michelle has a private practice in clinical psychology in Ottawa, Canada, and is a member of the College of Psychologists of Ontario. She helps patients with a wide range of issues, but has special interest in counseling people with health issues. She combines her knowledge about changing thoughts, feelings, and behaviors with the understanding that comes from personally living with type 1 diabetes for 15 years. Michelle has made it her mission to bring more psychology into healthcare in Canada by teaching healthcare professionals across the country about counseling approaches and strategies for strengthening their connection to the patient. So now I'm going to switch the screen over to Michelle, and she will take over in just a moment.
Thank you. Okay, I'm just making sure, getting my slides up here. Okay, great. Okay, and everyone can hear me okay. So today we're going to be talking about supporting patients using motivational interviewing, and I hope to use some examples from my own cases and keep it interesting by using some examples to illustrate some of these techniques. I know that a lot of people have heard about motivational interviewing. And some people have had, in healthcare now, have had training on it. It's become very popular in recent years. It initially was developed out of work in the addictions field, but now is really being used across healthcare. What we're going to do today, I'll talk first about the learning objectives, and we're going to be kind of looking at it within the context of working with chronic illness and lifestyle change and some of the kind of broader issues that a lot of our patients deal with. So the learning objectives for today, first of all, we want to discuss some of the challenges for patients with chronic illness, and then also the challenges for those of us who are helping and supporting them. And I'm sure that as you hear that, you can think of many challenges that do come up. We want to explore the spirit of motivational interviewing, which we also call MI, its key elements, and the guiding principles. We'll also try and better understand the term guiding style. So one of the big parts of motivational interviewing that we need to look at if we really want to start to use it and apply it, and even many people who have had training in it find that keeping it as a part of their practice can be difficult. So it's always good to have refreshers and to think about these, this guiding style. But we want to better understand what the guiding style looks like and how it's an alternative to a directing style. And in healthcare, we do tend to see more of a directing style, which there's definitely many moments and many consultations where we need to use a directing style, and we'll talk about what that looks like. But what we usually find is that using a directing style is not that helpful, or not often very helpful, when we're having discussions about lifestyle and behavior change. These are areas where patients can get very defensive and guarded, and so we want to lean more towards a guiding style. So that's one of our objectives for today, is to understand all of that better. And then if we're looking at a directing style, we need to examine the communication skills of asking, listening, and informing. So we'll be talking a bit about those. So let's think a little bit about some of the challenges. Well, first of all, what I use in my counseling is a cognitive behavioral style of counseling, where we're always looking at the connections between our thoughts and our moods and our behavior. Well, we've really got some big challenges with a lot of our patients, because if you think about your thoughts leading to your moods, well, most patients, most people, in fact, have lots of opportunities every day to think negative thoughts about themselves. So, for example, every time someone lights up a cigarette, they can think negative thoughts about themselves, or they overeat, or they eat the things that they have been told they shouldn't be eating, or they skip the gym, or they're not active. So there's lots of opportunities for all of us every day to be self-critical. What happens when people think in a really self-critical kind of way is that all this negative self-talk increases the incidence of depression and anxiety. And for many people, that talk is not just internal. They may have family members or people around them who are quick to point out the things they should be doing differently. So what happens is then when we see these patients in our office or in our workplace, they may appear very oppositional or uninterested in hearing what you have to say, or even just in connecting with the medical team. And then that's easy for us to kind of interpret as, as a negative, and we can pull away. But in fact, what it's indicating is that there's more we need to do to connect with them. So the larger issues may be related to feelings like shame, defensiveness, or guilt. The question, and actually there's a resource that I mentioned at the end on my last slide, just a couple of books, but one of them is the main Motivational Interviewing in Healthcare book that I've used to sort of learn about MI over the years, that I really recommend. And the other one is kind of different, a little bit different for healthcare, but it's a book called The Gifts of Imperfection by Brene Brown, a social worker, who does a great job at looking at issues like shame and guilt. And I think, it's great learning for all of us. It's good self-help, but really helps you to kind of empathize with what's going on underneath the surface for a lot of our patients. So the question we have now is, okay, how as a healthcare professional can we connect with these patients and encourage change? If there's any questions at all, we can, don't feel free to interrupt me as we go on, or as Danielle said, to kind of, flag her and let her know. So this is a quote that I think is a good jumping off point for us as we talk about motivational interviewing. This could kind of summarize, one of the main kind of principles in a way, or underlying tenets of motivational interviewing. What people need is a good listening to. Sometimes you kind of, I think patients often picture themselves going into a doctor's office and kind of having someone's finger kind of wagging at them and being scolded, and that kind of like, oh, this person needs a good talking to kind of feeling. But what people really do need, I believe this so much, is a good listening to. So I saw that expression somewhere, and I think it's a good one to keep in mind as we talk about this stuff. So first of all, we're going to look at kind of the spirit of motivational interviewing, just trying to capture the feeling of it a bit. It is a clinical style. I mean, motivational interviewing is based on evidence and research and on work with patients. So it's a clinical style for eliciting patients' motivations for making behavior changes in the interest of their own health. We're trying to tap into their motivation and to draw on what they know and what they believe. Some patients, of course, are much more ready for change than others. And part of, the kind of finesse of working well with patients is knowing how much they're ready for at different times and picking up on that. No one is without goals or aspirations. This is really important to remember, because sometimes that's not apparent, and sometimes it looks like our patients actually really are not motivated at all. Everyone has some goals and aspirations, but some people need a lot of help in identifying their motivation to make change. So for some people, maybe it's about being there for their family. For someone, it might be that they'd really like to be able to travel in their retirement years, and they know they need to take better care of themselves. Some people might just want to improve their energy levels. There's lots of different motivations that different people have. The way you talk to patients about health can substantially influence their motivation for change. So this is where we look at focusing more on guiding than directing. Guiding is accomplished by becoming proficient in asking, listening, and informing. So those are some of the things we're going to be talking about. So let's look at some of the key elements here of MI. One of them is that we want it to be collaborative, right? That only the patient can make the necessary changes. And so what we're always thinking about is how to make a conversation more collaborative. And when we're looking at having, and we'll be talking more about these styles, but being more directive versus guiding, like a more gentle kind of guiding approach. In fact, even when we need to use a more directive approach where we're informing and telling someone information, even then you can keep a collaborative style by asking permission and by checking in with the patient. So for example, if you picture a consultation where you think, oh my gosh, this patient has been smoking for so long, and I know so many times their healthcare professionals have told them that it's a problem, and now there's, these lung issues developing or something like that. You might want to say to the patient something like, there's some information I need to give you about the link between A or B, whatever's happening, and your smoking. Is that okay? I know you've probably heard about this before, but I do feel like I need to share a little bit of information with you. Is this an okay time to do that? And it can feel so different for a patient when they're giving you permission rather than feeling like they're the information is just coming at them. So the collaborative approach is so important. This also comes up with agenda setting, that when you kind of are meeting with someone and you maybe only have so much time, a good way to make it feel collaborative is checking in and saying, okay, here are some things that I'm hoping we can cover today. What about you? What would you like to put on the agenda? So it's a real sort of back and forth, kind of like there's two experts in the room. There's the patient who's the expert in his or her own health and their life and what's happening with them. And then there's you who has this expertise in the medical knowledge or facilitating conversation. The second element that I think is really important to touch on is evocative. So our purpose is to evoke from patients, to kind of draw out from patients the motivation and the resources for change that they already possess. I'm thinking of a consultation I did the other day with a patient who comes in once a month for therapy, and he's had a lot of crisis in his life, lots of ups and downs. And so there's, always lots of things to check in on. But in the last, year or so, things have calmed down. And one of the things that I know is a big issue for him is that he is a long-term smoker, and there's no doubt that it's affecting his health. And he, has grandchildren and also a younger child of his own, and it's hard for him to keep up with them, and he describes that. So the other day he was telling me about needing to go see his family doctor because he had run out of his puffers. And I didn't actually know that he was having to use steroids and that kind of thing. So I asked him about it, in a curious way, like, oh, how, what do you use and how much do you need it? And I knew that if I said to him, that's related to the smoking, that of course he would get defensive. So I sort of asked, I said, oh, does your family doctor talk to you a lot about the smoking? And I kind of said it with a smile. And he said, oh, everyone's telling me not to smoke. And I just tried to ask questions that were not about, well, I certainly didn't give advice or say what he should do, but I asked him how he felt about that and what that was like. And then before I knew it, he was volunteering the information that he once quit for 3 years, which was a great opportunity for me not to jump in and point out that that meant he could do it again, but to ask what it was like and to, bring up the things that are important to many smokers. Like I said, oh, did you miss it? Was it hard to be around other smokers? And it was really interesting because he was bringing up his strengths. He said, oh no, you know what, once I quit, I was fine. You know, the reason I started again is because I went to a funeral and I had one puff and then that was it for me. And so then he's tapping into information about how he knows that if he did quit again, he can't have even one puff of a cigarette. So what he really started to talk about was why he would want to do it again, even though he doesn't want to do it right now, and the resources that he had, like that he did have a really strong willpower, that once he got it out of his system, he was okay. So I think that's maybe an example that illustrates a bit how it's important to be evocative, that rather than being instructive or informative, at times the way you can best get patients thinking about how they could be capable for change is just being curious and interested and wanting to know more about their experiences. So the third element we'll talk about a little bit is honoring patient autonomy. And actually the last example I gave would be another good example that, or would tie in with this element, that we have to accept that people make their own choices about their health and their lives, that our guidance and advice may not be followed. And what that kind of goes hand in hand with is taking a little bit of pressure off ourselves that we have to see certain changes at certain points to be doing our job successfully. I think that's a big thing for, you know, many health professionals. And I believe it comes up in my slides somewhere, but one of the things that we really have to watch out for is the righting reflex that many health professionals have. So that's this kind of reflex to make things right, to correct, to fix the problem. Actually, in many marriages, it's what women say about men, that they just want their husbands to listen, and that the men want to jump in and solve the problem or tell them how it could be better. So with patients too, like, it's really important for us to kind of be careful about that reflex we have to jump in and fix, and to think this is up to the patient. And if we take that pressure off ourselves and we see our goal as being to have helpful conversations, to be evocative, to be collaborative, and yes, sometimes that there's certain things we have to inform them about or information we need to share, then what we're really doing is we're honoring their autonomy. We're seeing them as, you know, sort of adults who have the ability to make their own decisions, and even if we don't agree with them, to be respectful about it. So I know with the patient I talked about the other day, that for sure, that I met with the other day with the smoking, that for sure if he ever felt that I was pushing him about changes, he would not want to talk about these things anymore. So those are some of the elements of motivational interviewing. And now looking at the principles, we actually just talked about the righting reflex. So we do have to sometimes suppress this righting reflex if we want patients to start arguing for change themselves. That's a really important principle. I think many parents would say they can see the same thing with their children, right, or with their adult children even, that if you're always jumping in and trying to fix things for someone, that they kind of instinctively argue against it. But if sometimes you sit back and you give them the space to work on it themselves, that all of a sudden they're starting to argue about why they, or arguing for change, kind of talking about why they can be capable of changing something. The next principle is to understand and explore the patient's own motivations. And we've touched on this a little bit, but that if you ask your patient why they would want to make a change and how they might accomplish it, that they will then end up feeling like they're taking ownership rather than having someone tell them how to do it or what they should do. The basic, you know, kind of underlying principle here is that people just do not like being told what to do, which makes our job as healthcare professionals really, really difficult, right? We're often in a position where we feel like that's what we need to do. So we have to really keep that in mind, that it's better if you can get them talking about change. Listening with empathy. I think that one of the, the things that happens in kind of human relations and communication between people in general is that people get a little mixed up between empathy and sympathy. Sympathy is, yeah, feeling for someone and sort of like, oh no, that's too bad. But empathy is putting yourself in the other person's shoes and really kind of being with them and trying to understand how they're thinking or feeling. So this helps us to better understand how the answers to behavior change lie within the patient. If you're really trying to empathize with someone, for example, if someone comes in and is talking about their struggles, for example, with diet and how that's affecting their health. If we try and empathize with them, we're really trying to figure out how they're thinking or feeling, and then asking questions accordingly. Just being curious and interested. We're much more likely to find out what's impeding change, what's getting in the way for them. And the last principle to touch on here is empowering the patient. So if we really believe our patients are experts in their own lives, and if we convey that through the way we interact with them, and even saying, look, there's 2 experts in the room here, and I can't get anywhere without your expertise, I think that that's a real, kind of empowerment for patients that they don't always have within the healthcare system, right? Many patients feel they get frustrated, and sometimes they've had bad experiences. Luckily, many times they've also had good ones, but it's not always the case that they feel empowered about their health. People get scared about their health. If there's any questions, I'll just take a little pause just in case. Okay, so now we'll talk a little bit about using a guiding style. There's a really great quote from the Motivational Interviewing in Healthcare book that I like a lot, and it says that motivational interviewing involves guiding more than directing, dancing rather than wrestling, and listening as much as telling. And I think that that really kind of sums up, a little bit about what it feels like when you're having a good conversation with a patient, right? I think that so many people can think of consultations with patients where it just feels like things are going well and there's a good connection. And then there's other consultations where you just think, okay, why is this going so wrong? Why does this feel so difficult? I had an example the other day that was not related to healthcare specifically, but I think it kind of illustrates this. One of my patients was talking about having a new grandbaby, and she's already had other grandchildren, but it was the first baby for her youngest child. And she said how him and his wife are, they're exhausted. They're finding it really difficult. And the latest thing, because the baby's 3 or 4 months, is that she's flipping over at night, that she'll be sleeping and then she'll flip over onto her tummy or onto her back and start crying and wake them up. So they're so tired. So my patient, we'll call her Paula. So Paula goes over one day to help, to go over to hold the baby for an hour or 2, and she said that she kind of goes into the house, and she'd been on the internet, she'd been Googling, and she'd been researching, and she found, ideas of what to do about this problem and how quickly the baby would outgrow it. And so she gave all this information. So she was informing and telling them. She said, oh, I know what you need to do. I looked it up online, and there's this and this and this. And she said she could just kind of feel the couple retreating from her. Her daughter-in-law said a few minutes later, okay, I'm just going to go have a shower. And then she felt kind of this, shame come up, like, oh, what's wrong with me? What did I do wrong? And later, after the couple had a break, they had lunch, and then afterwards her son was alone with her and said, Mom, you can't do that. Like, you can't come in here and just, like, kind of jump on us and give us all this information. And she said, well, I'm just trying to help. I just want to make things better for you guys. And then he said, don't you remember what it was like when you had kids with Dad? Like, you're so, it's so hard. And she said to him, no, it wasn't. It was fine. And she said, maybe I'm not remembering, but we were fine. They're just worrying too much. And so again, she's sort of trying to make it okay for him. So we were able to debrief this, and I said, is the real issue that you find it really hard to see him tired, and like you want to make it all better. So it's that righting reflex, right? She wants to fix it and make it better. And what they feel as a couple is that they don't feel heard. And that's the really big challenge in using a guiding style, is that if you're really listening and kind of following someone and trying to, really understand them, there's a whole bunch of barriers, and there's obvious ones like criticism or, correcting people. But then even some of the things that can be good in other moments, like encouraging or, advising, like those are things that are okay sometimes. But if someone just needs to be listened to, then even those things can be off-putting, right? So for a couple with a new baby, whether they're talking to their family doctor or to a grandparent, if someone just jumps right into telling them how they should be doing everything, it does feel like, well, you must be doing something wrong. So what my client and I worked on is that if she goes in and she just listens to them talk about the difficulties with the baby, and instead of saying, but she's so great, she's such a good baby, if instead she said, oh, it really is such an exhausting time. I know it's going to get better, but right now you're just so tired. And just to reflect and stop there, it's a lot more kind of inviting for the couple, right? They're more likely to open up and to talk more. So hopefully that's a bit helpful just in understanding like how it feels to be guided and to be listened to versus to be directed. And another, kind of related to that example, another good way to think about directing versus guiding is if we break it down into the 3 different styles, actually, because I've been talking about directing versus guiding, but there's another style that people can use, which is just following. So if we think about it in terms of parenting, and there's a really good kind of illustration of this in the motivational interviewing book that I refer to. They say, okay, if you look at parents who are looking at their little infant or toddler explore, like play with blocks, a parent who's directing would be constantly correcting and telling them how to do it. They would say, no, 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 put the big blocks on the bottom, put the smaller blocks on top. Someone who's following, a parent who's just following, would just maybe sit back, sip their coffee, watch their child play, and not offer advice, not offer help. And there's times where that's appropriate. But guiding is where you kind of go back and forth using both. You watch patiently. You might watch them doing things and think, oh, gosh, if only they did that, it would be better. But you give them time, and then sometimes you step in as needed. And what's been found in research is that parents who use a guiding style versus just following or just directing have children who are the best at self-regulation, kids who are the best at kind of managing their emotions, at problem solving, at, figuring things out. So it's kind of interesting when we think about healthcare, because similarly, we want our patients to build good skills at self-management. I mean, that's what these webinars are about, is that patients need to be able to manage their own health and to reach out for advice and direction as needed, right? And so just like children need to learn self-regulation skills, so do us adults. So that's kind of what a guiding style is really about. And if you think about healthcare professionals, like, they talk about doctors with a good bedside manner. I think sometimes we just think, oh, some doctors are just, friendlier or warmer than others. But in fact, I think it's probably much more than that. It's about doctors who are good at switching between these styles, knowing when they come in and say, okay, Mr. So-and-so, we really need to work on your blood pressure, and these are the things that I'd really like us to try to do. But then if Mr. So-and-so gets upset or looks really frustrated, being able to do some listening and some reflecting, and therefore switching into a guiding style where you say, so what's getting in the way of doing this? Or, how are you feeling right now about these suggestions? So when we're using motivational interviewing, we're using a guiding style, but of course I'm not suggesting that, it's the same thing as, the way parents communicate with their kids or whatever. It's a guiding style, but a very specific one where, we're trained healthcare professionals, so we're incorporating the ability to be goal-directed, that within a consultation you can be listening and you can be reflecting, but you know that you have goals you're working towards, and you're kind of finding a balance between being patient in the conversation but also gently moving the patient towards the change talk that we need. You're also skilled at evoking patients' own arguments for change and using your clinical skills to do all of that. So it's certainly a guiding style that is more than just how any two people communicate. It's really used within a clinical context. Now we're going to focus a little bit on each of the different skills, like the asking and the listening. And there's so much we could say about each one. And again, for people who are interested in learning more, the book is really a wonderful guide and really helps to illustrate these not just with kind of theoretical information and stuff, but it's actually very readable because they use examples to illustrate it, and they have patient healthcare practitioner conversations like transcripts. So I think it's a great learning tool. But we'll kind of do a little Coles Notes of each one and try and touch on some of the important points. So at the heart of motivational interviewing is the belief that patients do have most of their answers within them. Once you have this frame of mind, the helpful questions usually follow, and you know what to ask. We want to use open questions. So like an example would be, rather than something where people can just answer yes or no, like, have you worked on reducing your sodium, or have you reduced smoking, or whatever it is that we're talking about. But instead saying, can you tell me some of the challenges you've had with your health since I last saw you? Similarly, of course, you could say, can you tell me some of the improvements? So these are like open questions that put the patient in a position where they hopefully will provide a little more information than if you were just getting yes, no answers. And what that also does is it sends a signal. If you actually listen, let them speak, let them provide their answer, and then reflect on it, like kind of summarize what they're saying, or show that you've really listened to them. The message it sends is, I want to hear more. Like, I want to understand what's happening. I'm sure, many of you can think about your own experiences as a patient in healthcare, and that sometimes, no matter how well-intended our healthcare professionals are, I know I've had these interactions at times over the years where you feel like it's a bit of an interrogation, and actually, you can become quite skilled as a patient at providing very short, concise responses, because the message you kind of feel like you're getting is if you give more information, you're going to get cut off, like you're being too detailed. And so for patients who we actually want to open up and to start tapping into their motivations for change, they may really need, a lot of indications that you're willing to listen and that you want to know more. So if a patient does express some intention to change, we're always looking for change talk, and they give a lot of good examples of that in the book I mentioned, actually. You want to try and get more specific. So for example, you want to try and get them to express their intentions in terms of what, when, and how. Like a question might be, well, what would need to change for things to feel better a month from now? Or what would you be doing differently? If you have a patient with diabetes who wants to reduce their blood sugar levels, well, how could you get started on that? What are just some little first steps you could take to get there? So now let's think a little bit about listening. Listening is often thought of as sort of like a more kind of passive exercise, that it's something that is just about sitting back and listening, receiving. But it's actually so much more active than that. First, important to kind of think about what it's like for people when someone is listened to. Being heard and understood, and you can think about this within the context of medical teams, but also like personal relationships and families and work colleagues, that when you feel like someone is really hearing you and understanding, that in itself is very healing. So if we think about patients who are, living with long-term conditions and chronic health issues, they have many times where they feel quite alone with their illness. Even if they're surrounded by family and friends, they may not always feel like people really understand. That's why we know that people who are going through cancer often find a lot of comfort from being around healthcare professionals or other patients who really understand and, deal with cancer in their lives. And the same goes for many other health conditions. So with listening, we can never, ever kind of downplay the importance of just how much it can heal people to feel like someone's listening to them. Listening really well helps us to gather important information that you might otherwise miss. What I always say to when I've done training with other counselors and therapists is that if you keep in mind this goal of being curious and open-minded, so often you might be formulating a hypothesis in your mind of what we need to talk about or what's wrong or what's underlying this problem. But sometimes information that you wouldn't have thought would really get you anywhere, that the patient just seems to want to talk about, ends up being super helpful. You know, so I know I can think of times where I've worked with, I do a lot of work with patients with diabetes, and I, you know, think of young people I've worked with who are really struggling with their diabetes control, and their parents or their doctors refer them for therapy, thinking, okay, we need Michelle to do more work on the diabetes stuff with them. And then it ends up being something totally seemingly unrelated that needs to get cleaned up in their life before they can address the diabetes. Like, you know, a young woman who said, well, I always feel left out because my brothers are always together and I'm the odd one out. And it was as simple as the family becoming more aware of needing to do things together as a family. And then when she felt happier, she could focus more on her diabetes management. You know, similarly, if there's things going on at school or at work for people. So while it may not be your job, you know, to do therapy and to work through all those issues, it's surprising how often people will say, oh, now I've told someone about it, it feels better. And then they're able to start to focus on, you know, their health a little bit more. So not only are patients more comfortable and feel more bonded to healthcare providers who really listen to them, they actually may be more likely, there's been studies that have shown that then they're more likely to adhere to advice, to actually listen to when you do need to switch into that kind of informing and educating mode, that they're going to be more receptive to what you have to say. When you're listening, you really don't want to have any immediate agenda other than just understanding the other person's perspective and their experience. So you're kind of trying to just slow down a little bit. One of the expressions I like is slow down and progress will be quicker. That sometimes having, you know, if you have a half hour or 45-minute meeting with a patient where it feels like you didn't really get anywhere because you didn't tackle any goals, you didn't send them away with a to-do list or tasks. But if in that interaction they really felt like they made a connection with you, that who knows how that might change their healthcare management down the road. I remember one of the examples of that really stood out to me was a woman in her 20s who had had diabetes for many years and was on quite an outdated kind of, you know, insulin setup, you know, on a couple of injections a day, and her doctor for a long time had wanted to get her onto a newer, more stable insulin. But whenever it was brought up or advised, the patient was always quite comfortable to just say, nope, not going to do it. I'm not ready. I don't like change. That's it. That's all. And she did engage in therapy, which her doctor had recommended, and I didn't push for those changes. But eventually she got to the point where she was wanting to manage her diabetes and to stabilize things, still scared to make the change. And she started meeting more often with her nurse educator and her endocrinologist. And then I remember one week she came in and said, okay, I'm going to do it. I'm going to switch to Lantus. And I'm, you know, going to move to multiple daily injections of the fast-acting insulin. And I said, so how come? Like, well, what got you to this point where you're ready to try? And she said, well, you know, I had this appointment with my doctor, and my doctor pushed aside the file and said to me, because the patient was conveying how scared she was, and the doctor knew from me as well how anxious she was about it. And the doctor said, anything we can do to help you. Like, I so want to see this get better for you. If you want to meet with me every week, I will meet with you every week. And the nurse educator said, and I carry a pager with me. You can page me anytime while you're getting used to these changes, anytime you have a question. And the patient was teary-eyed telling me about this and said, like, I know they are both so busy, and it just meant so much that they were willing to do this for me. And I know that her feeling like she had this supportive team of myself and her nurse and her doctor just having that emotional support is what gave her the courage to make those actual behavioral changes and changes to her management. So there's no doubt that she started to open up to their advice because she was feeling more connected and because they were offering up even more connection. And of course, she didn't end up making multiple phone calls or pages or whatever. It was just the knowing that they were there that made the difference for her. So when we're listening, we don't want to have any immediate agenda other than understanding the other person's perspective and experience. Asking and listening together. So we kind of want to put these skills together, the asking questions, the listening. So to kind of summarize how we can do that, one of the things that I always think about is to try to ask, of course, open rather than closed questions, which we talked about earlier. So the open, they have to kind of give an actual sentence response versus the closed where they can say yes or no. And of course, you're not going to, sometimes you're going to end up asking a question that is yes or no, but you just want to aim for more open. But then really important is to try to actually not ask a couple of questions in a row. So the way you do this is that you really force yourself to work on reflections. So reflections, as many of you know, because you probably do it instinctively, it's the paraphrasing or summarizing what someone has just said in a statement, not a question. Reflections, there's many different types of reflections, and they're well described in the in the Motivational Interviewing in Healthcare book. But whether it's a really simple reflection or kind of a more amplified, incorporating emotion question, you're not including advice. You're just kind of reflecting back, mirroring what the patient has offered up. So if you ask a question, for example, you know, well, how's your blood pressure been lately? Or, you know, how have you been taking your medication? You know, or how are you finding it with taking your medications as directed? You know, something like that. And they provide an answer and they say, well, it was like a really bad month because I was sick and this happened and this happened. And, you know, at one point I ran out of my pills and it took me 2 days to go get them. And so then rather than asking another question or offering advice, you say, oh, wow, so it sounds like it was just a really hard month to stay on track with such and such happening and then this. And then you just wait for a moment. And even if they don't say anything right away, you at least give, you know, what might feel like a really long pause, but you just provide some silence and opportunity because you never know what might come next, right? Like that patient in their head might be thinking, oh, and I felt so bad about it that then like I fell off the wagon with my eating, or, you know, like there might be something else that would be really helpful for them to say out loud. Because when people say things out loud, they don't sound quite so bad anymore, and then they're more likely to change the behavior. So this whole kind of idea of not asking too many questions in a row, the way you accomplish it is by doing more reflecting in between the questions. And this does take practice. Like I don't think that it's always, some people are really good at it naturally, but sometimes depending on the setting you've worked in and the way you've, you know, kind of had to work at times, it can feel like a bit of a change. I remember at one point when I was working at the Heart Institute here in Ottawa, we were doing some like group work together with a group of health educators who worked in the Heart Check Center. And we did an exercise where I would say like a patient statement, you know, like a statement about their health, something that a patient would say in a consultation. Excuse me, and then everyone else's job was to go around and to make a reflection on it. And we ended up like, we would all end up laughing because someone would make what was supposed to be a reflection and they felt really confident that they were reflecting, and then they would realize that they had just asked another question or they had offered advice, because it really is such an instinct for so many of us as healthcare professionals. So it might be something where you actually really try and pay attention to it just in some of your conversations. And then it's like a, you know, it's like an experiment. You try it out, you try doing more reflecting. Don't worry if it feels a bit odd or unnatural, like you just have to practice it. And then you see how the other person responds and how it feels in the consultation. I think that, many people can probably think of examples in their personal life where this is effective too, where if you, like the example I gave of the grandmother earlier, where when she jumped in and gave lots of advice and, wasn't really listening, she was kind of more telling, that it didn't feel comfortable. And that's kind of the objective I sent her away with. I said, look, next time you're with them, try doing it differently. Just try reflecting on what they're saying and, empathizing and see how it ends up feeling for you. So I think as healthcare professionals, that's the same thing we can do with our patients. We just try and be conscious of it and, do more of that, do more reflecting, more listening, more empathizing, and see how it goes. Does it end up being more productive? So now I think we have time to just do a quick case study. So we'll go through the case study and kind of think a little bit about how motivational interviewing fits in, right? Like it's not about gimmicks or techniques, but like how does motivational interviewing become part of kind of like the feel of this interaction? The patient I have in mind is, I'll call her Anna, and she was someone in my practice who was about 64 and a grandmother, and she had type 2 diabetes. So she had been diagnosed probably a couple years before she saw me, but there was kind of a whole pre-diabetes phase where there was one doctor who said she didn't have diabetes, and then she moved, she got a new doctor, and the new doctor said, oh, you have diabetes. And she was a little frustrated with her healthcare experience. She felt like she'd been bounced around a little bit, and she was able to express that she felt a bit guarded about all of that. She was coming to me for other issues as well, not just about managing her diabetes. She had a lot of anxiety, but the diabetes was definitely there as an issue in the background. And her overall health, taking better care of herself, bringing her anxiety down so that she could manage her health. So what had happened is when she did get diagnosed with type 2, she did use her diagnosis as a motivator for changing her eating habits. She kind of gotten really on track with her eating, cutting back on carbs, eating a lot of healthy food. Then she'd had a period where it wasn't going well, and then she got back on track. So it had helped her to lose some weight, and her blood sugars had actually come down, apparently, from what she reported. I never saw the results, but apparently her and her doctor were quite happy with her actual blood sugars. However, in terms of overall health, which was very much related to the mental health issues of anxiety and depression that I was working on with her, alcohol use and activity continued to be challenges. So underlying issues for her included a lot of self-criticism, which went right back to her childhood and a very critical parent, and a history of anxiety and self-esteem issues. So when I look at how I applied the principles of motivational interviewing here, and it's not like I was consciously doing this every session, but when I step back and look at the case, it was so important with Anna. First of all, she needed to tell her story. She needed to establish a bond with me. There was no way I could push her on things like alcohol use within the first hour of meeting her. So she needed to establish a bond, and of course that comes from feeling like someone's listening to you and connecting with you before you try and establish goals. So I really got to understand her experience and various stresses in her life. But it wasn't that this took, numerous meetings. It's just that for the first couple of times we met, we didn't try and do, ambitious goal setting. It was more about telling her story and connecting. So then, it became very clear that there was an issue around alcohol use, and she became more comfortable talking about it. She did not indicate it in the beginning. It wasn't dramatic, compared to some patients, but definitely on a daily basis she was using it as a coping strategy in terms of relaxing at the end of the day, and it was probably affecting her sleep, and there's that whole kind of cycle. So it was very important, if we think about another kind of principle of motivational interviewing, it was really important to be collaborative. For me to ask her if she wanted to set any goals around change, did she want to talk about some of the steps she could take. I had to really try and, again, being evocative, help her to focus on her motivation and why she would want to change these things, but definitely to keep a sense of collaboration where she was coming up with the steps needed to reach these initial goals that she was setting, and that, I was making sure that it was like an approach she felt comfortable with. One of the things that I find is really important in terms of establishing a bond and good listening is to sometimes slow patients down. I mean, sometimes when they get into the place where they say they want to set goals, part of it is because they want to please their healthcare professional. So sometimes they might be really quick to say, yes, I'm going to, walk every day, and I'm going to change this, and I'm going to do this. And sometimes our goal, I think, is to reflect back and to actually kind of slow them down in terms of how quickly they're trying to make their changes or how big the changes are. And also reflecting back the changes that they've already made. So someone who's self-critical, who, maybe has had a rough time with their health, is often very quick to think about all the things they're not doing, to feel guilty about what more they could be doing. And in fact, what can really motivate them to get there is to say, well, hold on, like, what about such and such that you did? You've already done this, and, you really set yourself up by change for doing this, or by doing, A, B, or C. So listening really well to Anna is what allowed me to identify accomplishments. Because she was so self-critical, she was very quick to gloss over the things she'd already done, like lose weight and control her blood sugars. And what I had to really do is to slow myself down, not let that rating reflex cause me to charge ahead and to push for more change, but instead to not ignore the things she'd already done, because those were such powerful motivators, things to boost her self-confidence that would help her to make more change. In terms of how therapy helped Anna, that whole needing a good listening to is really appropriate for her. Just being able to express some of her feelings about her healthcare experience actually made her feel a lot better about the healthcare she'd had. She just needed to let some of it out. As I empathized and asked questions, she was able to identify changes she could make, and she had really good ideas. She just needed a good listening to so that they could come out. She began to acknowledge why and how she'd used alcohol as a reward and a comfort on hard days, and just saying it out loud, talking about, saying it's not that I don't drink to get drunk, it's just like it feels so nice to have a glass of wine, and, having someone say, yeah, it's just the way for some people, like they love their morning coffee. When you're really busy or you're stressed, it's very comforting. And saying that out loud didn't make her say, oh yeah, I can't give it up. Once she said it out loud, she could acknowledge that it was something she could start changing. So she felt more empowered just admitting what was at the heart of this problem. She also noted and, kind of identified that when she had someone to talk to, being able to talk about her achievements really helped her to move forward. She was much more likely, although it wasn't perfect and it wasn't all the time, that's not what we're aiming for, but she had more weeks where she felt good about getting some exercise, eating well, drinking less. So the collaborative approach really helped her, just feeling like someone was in there with her, helping her to make the changes. I think one of the things to note is that, as well as a healthcare professional, when you provide a really positive interaction for a patient, you set them up for other healthcare professionals to have more positive interactions, hopefully, that they learn skills about collaborating that then they take to other parts of their healthcare experience. And I'll just quickly go through my last slide here, some helpful questions for setting goals. You can ask things like, what small steps would show, so this is when you've established a bond with your patient, then you can work on setting goals when there's lots of listening and reflecting. So some of the things that I like to kind of throw out there just to help people get started with goal setting is, what kind of small steps would show you're inching toward the goal? Have you broken it into smaller steps, or can we break it into smaller steps? How many months would be reasonable to reach your goal? What are a couple of things you can do first? What would be the first sign that you're making progress? If a friend or someone you admired set this kind of goal, what would you say he needs to do first to get started? And then checking in with your patient, making sure that the goals they're making are focused on changes that they can make, not changes that they want others to make, so not depending on other people in their family, you know, quitting smoking or changing their eating or what have you, and that the goal is realistic. So this kind of goes hand in hand with the motivational interviewing stuff we've been talking about, because as I said, the objective with the guiding style is to get to goal setting. It's just that sometimes we have to slow down a little bit and give them the chance to connect with us before they're ready to do that goal setting. And I guess just one of my concluding thoughts I'd like to put out there, sometimes this comes up when I talk about motivational interviewing and people ask questions, and sometimes people will say, well, some people just come in and they just want to be told what to do. And I do agree with that. You absolutely will have patients who, well, some patients are not comfortable opening up, and a way of connecting with you is just being with you while you educate them. And then some people will say that. They're like, look, I'm ready to make this change. Just tell me what I need to do. And so when a patient has given your consent, then it's collaborative, and of course it's okay to use a directing style or to be more kind of informative and educating them. So this is the whole idea with MI, is that we use different styles when it's appropriate, and that the more we practice that, the more kind of instinctive and, you know, the easier it becomes for us. And now I've just got the recommended resources up, and as I said before, this Motivational Interviewing in a Healthcare book, it's quite a small book. You could look it up online, like on Amazon or something, and you'll see it's just a small paperback versus the big motivational interviewing textbooks, because it's specific to healthcare, and it really is a wonderful resource. I highly recommend it. And then just out of interest sake, for those of you who kind of want to get to some of the underlying issues around shame or vulnerability that come into chronic disease and self-management, I think in so many cases, you could read The Gifts of Imperfection by Brené Brown, who, as I mentioned, is like, she's for years and years has been researching these emotions, which not many people do. Or if you kind of wanted a Coles Notes of her work, just to get a little like idea of it, she has a couple of TED Talks. They're like little online videos on YouTube of kind of speeches she's given. One that really went viral, it's one of the most popular TED Talks of all time, is on vulnerability. So if you Google TED Talk vulnerability, Brené Brown, it would come up. So again, this is kind of like not directly, it's not motivational interviewing specific, but I find it's about the emotions that make change so difficult for so many of our patients. And that's all. And then if there's any questions, hopefully we have a few minutes here.
So does anybody have any questions for Michelle? I didn't see any come up during the presentation, so we would just want to give everybody a chance now. And what I'll do as well is I'm going to mute everybody right now just in case there's some technical difficulties. So if anybody wants to speak up right now, you can go ahead and say something. And otherwise, you can still type into the chat or question box that should be in that window of yours. Okay, well, there doesn't seem to be any questions this time around, Michelle. I don't know if you had any final comments or closing remarks, or if we should say goodbye.
Yeah, just that, again, like, start small. If people are trying to incorporate more motivational interviewing, you don't have to go out and read the book, but, you know, the basic idea of it is kind of, you know, just nudge a little bit, listen, empathize, like you're just taking it slow with the guiding approach, staying in the moment with your patient, being able to, you know, have these kind of goals in your mind and looking ahead a little bit, but finding that balance of, you know, staying with them and making sure they feel heard. If anyone, I think on my very first slide I have my email, but if anyone ever, you know, had any questions or wanted me to send them more resources, I'm happy to do that, so don't hesitate to get in touch. And I know that the slides and a kind of more detailed handout with just a little more information than we have in the slides is also Danielle has put up on the website. But yeah, thank you for joining us today.
Yeah, and that link to where you can download on the website will was in your reminders. And what I'll be doing later on today or shortly thereafter, if I run into some technical issues with YouTube, which I occasionally do, is a recording of this presentation will be in our archives, and I normally put any handouts as well as the slides with the space for the notes in that same spot in the archive as well. Tomorrow you'll get a follow-up email, and a direct link to the archive will be included in there if you're interested in either reviewing or sending it to a colleague who wasn't able to make it. So I guess in that case, we just want to thank you for coming, and we hope you enjoyed the presentation as much as we did. And hopefully we'll see you at next month's webinar as well. So thanks a lot, everybody, and enjoy your upcoming weekend.
Thank you.